Welcome to the Suicide, Homicide, and Welcome Carriage session. We have 7 presenters this afternoon, so I expect this will be a highly informative and a fast-paced session. We have asked all our presenters to try to stay to 3 minutes, but we'll probably have a few moments of flexibility in there, but it will definitely be fast-paced. Thanks for joining us. We're really glad you're here. Understand we're now in the middle of the afternoon of a virtual conference, so appreciate your being with us. As a reminder, this session is being recorded and only the presenters and the moderator are visible. The chat is disabled, so please use the Q&A feature for all questions. And if you do have a question for presenters, we ask you to use it as you think of the question as we go. And this gives us a chance to sift through them before we get to the Q&A so that we can use it most effectively. A live transcript is available for this session. If you'd like to hide the captions, please click the up arrow next to the transcript button and select Hide Transcript. So let's go ahead and get started. Please join me in welcoming our first abstract presenter, Hooman Azad, who's a medical student with the Northwestern University School of Medicine. Hooman.
Thank you all for the opportunity to speak today. Next slide. Among children and teenagers 0 to 19 years old in the United States, 25% of deaths are firearm related. Yet data on location and circumstances are limited. Our study used the National Violent Death Reporting System, which is a data source that collates data from hospital records, death certificates, and law enforcement to give case-level data on violent deaths. As of 2017, 35 states, Puerto Rico, and Washington, D.C. were contributing data. This study is a cross-sectional observational study focusing on children ages 0 to 19 years, with the main outcome measures of firearm storage status, location of firearm death, and firearm owner by intent. Next slide. While only 19% of homicides occurred in a child's own home, 68% of suicides occurred there, and 48% of unintentional deaths occurred in the child's own home. Looking at deaths that occur elsewhere, 22% of homicides and 10% of suicides occur in a home other than the child's own. What I really want to draw attention to, though, is unintentional deaths, where 33% occurred in a home other than the child's own. If you add these up, 81% of all unintentional deaths occurred in a home. Next slide. Unsurprisingly, the majority of these deaths occurred with a fire. Oh, if we can just go back a couple slides. Thank you. Maybe 2 more. Unsurprisingly, the majority of deaths occurred with a firearm, with this being used with a handgun, with this being used in 88% of homicides, 62% of suicides, and 64% of unintentional deaths. Next slide. Looking at who owns these guns, we can look at parent-owned firearms first. Not surprisingly, 12% of homicides use a firearm owned by a parent. However, 53% of suicides and 38% of unintentional deaths occurred with a parent's firearm. What I really want to draw attention to here is the shooter element. Of course, in homicides, the majority occur with the shooter's own gun. But what I think is important is suicides and unintentional deaths. In 22% of suicides and 23% of unintentional deaths, the firearm was owned by the shooter. This means that in 22% of suicides, a child owned a firearm and used that firearm to kill themselves. Next slide. Now let's look at storage. We categorize storage as least safe and safest. And just as a reminder, least safe refers to firearms stored loaded and unlocked, while safest is those stored unloaded and locked. When you look at the least safe form of storage, for 79% of homicides, 36% of suicides, and 84% of unintentional deaths, the firearm was stored in the least safe form. And not surprisingly, the numbers of firearms stored in the safest form are much lower for all 3 intents. Next slide. In summary, parents, friends, and family tend to own the firearms used in most cases of death in children and teenagers, and across all intents, firearms used are more often stored in the least safe form. Most firearm suicides and unintentional deaths occur in the home, and as a reminder, 1/3 of United States households have at least 1 firearm. This suggests that improving firearm safe storage may reduce pediatric firearm violence in the United States. Thank you.
Thank you. Now we turn to Dr. Melissa Osborne, Clinical Assistant Professor with the Georgia State University College of Nursing and Health Professionals.
Thank you, and good afternoon, everyone. Next slide, please. Our study had two aims. First, to identify risk patterns of adolescent firearm suicides, so looking across risk factors rather than looking at individual associations between risk factors. And then to examine how demographic factors relate to these risk patterns. We did this using data from the National Violent Death Reporting System. Specifically, we looked at data from 2007 to 2017, and we included decedents ages 10 to 17. We conducted a latent class analysis, or LCA, to identify the risk patterns, or classes, and a multinomial logistic regression to examine the relationship between the demographics and the classes. Risk factors for suicide included in the LCA were in the areas of mental health, relationship problems, and substance use. And you'll see those risk factors in the results. Next slide, please. The graph on the left depicts our LCA results. And you can see that we identified 3 risk patterns, or classes. Class 1 is represented by the blue line. And you can see that adolescents in this class had a low probability of all of these common risk factors. And they made up 50% of the firearm suicides. Class 2 is represented by the orange line. Adolescents in this class had a high probability of mental health problems, depression, and suicidality, and they made up 35% of the firearm suicides. Girls were more likely to be in this class than boys were, and compared to white adolescents, Black adolescents had lower odds of being in this class compared to being in class 1. Finally, class 3 is represented by the gray line, and these adolescents had a high probability of having problems at school, and they made up 15% of the firearm suicides. Younger age was associated with being in this class. In a post hoc analysis, we did an LCA of non-firearm suicides as a comparison, and we found that mental health featured more prominently in those classes. Next slide, please. So these findings strengthen the importance of consistent safe storage, even in the absence of observable risk factors, and prevention efforts focused on parents' safe storage behaviors are imperative. Additionally, we found that Black adolescents may be less likely than white adolescents to exhibit mental health warning signs for suicide. Suicide rates are increasing among Black children and adolescents, and future research should focus on factors unique to them, such as racism and disparate school disciplinary actions. Thank you.
Thank you. Now let's turn to Dr. Rebeccah Sokol, Assistant Professor in Social Work at Wayne State University.
Thank you. So the focus of this research was identifying best practices in firearms mean restriction for youth suicide prevention. Next slide, please. Next slide, please. So there are a lot of different approaches for reducing suicide risk by firearms, and these include means including physical and policy interventions, such as locked firearm storage and separate storage of ammunition and firearms, changes in firearm control policies, and firearm buyback programs. Next slide. However, one back, please. Thanks. Back. Sorry, the animation. Okay. But mental health providers also have a role to play in reducing suicide by firearms. There's evidence to support the use of counseling and education to persuade families to remove lethal means when someone in a home is depressed or suicidal. So we undertook a review of the literature to describe the state of training mental health providers on assessment and intervention in firearm-related suicide risk. Next slide. So evidence-based suicide prevention programs that specifically focus on lethal means counseling for mental health professionals are uncommon, as we found only one such training program, which is CALM, C-A-L-M. Our review of the literature reveals that the inadequacy of training for suicide prevention in general, and specifically in the knowledge and skills needed to initiate and facilitate firearm means restriction interventions in imminent risk and less acute situations. So research, however, has demonstrated a strong link between self-efficacy to provide counseling and such that professionals with higher self-efficacy as it relates to their suicide prevention work are more likely to be effective in engaging clients in difficult conversations. Often, however, mental health providers receive little or no education in the skills to discuss lethal means with their clients. So what we developed as a result of this review was a conceptual model of mental health providers' assessment and intervention in firearm-related suicide risk encounters. As you can see from this model presented on this slide, self-efficacy is at the center of this, whereby we believe that training programs should really surround identifying how to increase providers' self-efficacy to assess for firearm risk in suicidal encounters and to intervene with clients, family members, and first responders to restrict firearms in suicidal encounters. And the base of this, as you can see at the bottom, is really identifying those facilitative factors that can improve self-efficacy, such as what are the community attitudes surrounding firearms and firearm means restrictions? What are family relationships and engagement, suicide risk assessment and intervention skills, and interprofessional relationships that can all culminate to increase a mental health provider's self-efficacy to deliver this type of intervention. Next slide. Next slide, please. So the implications of this are that suicide risk assessment and intervention are consistently challenging in practice, and little is known about the best practices for firearm-related suicide risk. But our developed model hopefully will inform future mental health provider trainings on firearm means restriction. Thank you.
Thank you, Rebeccah. We will hear next from Suzanne McLone, MPH, Senior Epidemiologist with the Illinois Violent Death Reporting System in Illinois State Unintentional Drug Overdose Reporting System. Suzanne.
Okay, thank you. Hello from Chicago, everyone. So the title of my talk is Suicide by Firearm Among Youth and Young Adults in the State of Illinois by Urbanicity and Region, 2008 to 2018. I'd like to acknowledge and thank my wonderful co-authors and bosses, Drs. Marianne Mason, Lorianne Post, and Karen Sheehan. Next slide, please. So the question was, does urbanicity modify the effective region, or vice versa, on the proportion of suicide deaths by firearm among youth and young adults in Illinois? We used certified death certificate data in which the dates of death were 2008 to 2018, the location of death was in Illinois, the manner of death was suicide, and the age of the decedents was between 10 and 24 years. Means method was dichotomized into firearm versus non-firearm. And all 102 Illinois counties were categorized by both urbanicity and region, north, central, and south. In the state of Illinois, the regions are distinctly separate geographically, economically, politically, affiliation with national sports, etc. So we had an outcome variable, which was the means method, and we had essentially had two exposure variables, urbanicity and region. So I stratified our firearm versus non-firearm by region and generated some chi-square analyses using SPSS. Next slide, please. So here are our results. I'd like you to look first at the total column, and you'll see there's a significant negative association by urbanicity in the proportion of suicides due to firearms. So from most urban to least urban, there's a negative association. That is not surprising. Now, if you look at the total row at the bottom, there's also a negative significant association by region from north to south. That too is not surprising. When you combine and stratify, some of those associations disappear. And that's important. Next slide. For both prevention and educational purposes. So this preliminary study contributes to the investigation of how the proportion of firearm Suicide deaths in Illinois vary by both urbanicity and region. And this information could be used so that local health departments in Illinois could tailor youth suicide prevention efforts more effectively, and it helps to identify where education on safe firearm storage is most needed based on both region and urbanicity in Illinois. Thank you.
Thank you, Suzanne. And next, we'll hear some of the work of Corinne Peek-Asa, who is an Associate Dean for Research and Distinguished Professor with the University of Iowa College of Public Health.
Thank you, and this fits well within the lineup. So the team that I want to thank is the group that runs the Iowa National Violent Death Reporting System. We certainly are seeing how important this data have become for firearm analyses. So can we go to the next slide, please? So basically the question we're asking is, fact or fiction, long barrel guns are not commonly a mechanism for suicide. And this question actually came from the executive advisory board for the Iowa chapter of the Violent Death Reporting System. And in particular, the law enforcement members of the committee didn't really feel like long-armed weapons were at risk for suicide. So we wanted to come up with some data to indicate whether or not that was fact or fiction. And I also was very personally interested in this topic because that picture is my daughter who is shooting trap with one of the firearms we have in our home. So our data were from the Iowa National Violent Death Reporting System from 2016 to 2018. We started the full Iowa reporting in 2016, so that's why that is the first year of our data. We examined the frequency of guns as a suicide mechanism. We looked at the type of gun used and then factors associated with long gun use. And we also examined rurality, except we used the rural urban commuting area codes. Next slide, please. So we found that long gun suicides were more common in Iowa than in the national NVDRS sample, and more common in rural than urban areas. We found that Remingtons were the most common long gun used, and that's not surprising because they're probably also the most frequent. Although we also have a number of boutique manufacturers in Iowa, and we did find those to be related to use in suicide, but probably not disproportionately so. We don't really know. So we looked at factors associated with long versus short barrel guns in Iowa suicides, looking only at suicides by firearm. And we found that youth were more likely than older age groups, using 25 to 44 as the reference. In looking at rurality, the rural urban codes were isolated, large rural, small rural, which are mostly 5,000 people in a township or less, versus urban. And we found that both isolated areas, which are unincorporated, and small rural areas were statistically more likely to have long gun than short barreled suicides. And then we also found that owning the weapon was related to long gun suicides. So the implications, I have to fess up on the next slide, are a little bit more based on my own experience than a large evidence base, although the evidence base is growing. Can we go to the next slide, please? Okay, there are some policies and safety practices that have rural gaps. And I'm just gonna use lethal means counseling as an example, which is nice because we have expertise on this panel. So often lethal means counseling is conducted in trauma centers, and those tend to be in urban areas. So there may be some reach challenge with lethal means counseling. But then in addition to that, counseling on safe storage often includes gun safes. And I can tell you gun safes are very expensive for long barreled guns. Trigger or cable locks, which are other ways to secure guns, are easily compromised. And I can say that some of the counseling on gun removal can be a little bit counter to why rural people may have guns with them. And so, for example, it's very common to have a long barreled gun in your farm vehicle when you are out and about on your land. So that is all I have today. Thank you.
Thanks, Corinne. I think probably all of us are appreciating that each of you are sharing your thoughts about implications. I think it really helps us to think about how our work relates to each other and what some of the next steps are. So let's turn now to Karissa Pelletier. Karissa is a doctoral candidate with the School of Criminology and Criminal Justice at Arizona State University. Karissa.
Hi, everyone, and good afternoon. Today, I'm going to talk to you about the first two research questions in my dissertation, which looks at the covariates surrounding children and teen firearm victimization. Next slide, please. So these two research questions are, what are the covariates of firearm homicide for children and teens? And how do the covariates of firearm homicide differ for children and teens? In order to examine these two research questions, I am using the CDC's NVDRS data, which has already been mentioned several times today, across 15 states from 2005 to 2017. In order to answer research question 1, I did a t-test, and then the significant variables identified in research question 1 were then used in the OLS model to answer research question number 2. Next slide. So research question 1, what are the covariates of firearm homicide among children and teens? So when compared to child homicides, teen homicides were more likely to involve a firearm, have non-white and Hispanic males as the victim, be precipitated by another crime or be committed in the progress of another crime, be gang, drug, and alcohol related. Teens are more likely to be killed in a walk-by or drive-by incident that occurred outside. And they were also more likely to suffer from excessive violence in terms of being shot or stabbed multiple times. And then they were also more likely to be killed by someone other than a family member. However, teen homicides, when compared to children's homicides, are less likely to involve abuse or neglect that led to their death, have a history of abuse or neglect, or be have a family-related problem that caused their death when compared to children. Next slide. So for research question 2, how are the covariates of children and teen homicide different? So when compared to teens, children were more likely to be killed with a weapon other than a firearm, to be female or white, to have abuse or neglect that led to their death, and to be killed in the progress of a family issue, and to involve excessive violence in terms of being beaten to death. When compared to teens, children, however, were less likely to be killed during the commission of another crime, to less likely to involve a homicide that was gang, drug, alcohol, or intimate partner violence related, and to occur in an unknown or outside location, or to be killed by someone who is not a family member or has an unknown relationship with the victim. Next slide. In terms of implications, there are clear differences between the homicides of children and those of teens. This demonstrates a need for different prevention and intervention strategies for children and for teens, along with further exploration of these covariates. In terms of the next steps, I will be answering the research questions you can see presented on this slide, which will be examined using a multi-level models and including firearm laws in order to understand their impact on the occurrence of firearm homicide among children and teens. Thank you.
Thank you, Karissa. And now let's go to our final speaker in this session, Stephen Oliphant, a doctoral candidate at Michigan State University School of Criminal Justice. Stephen.
Thanks, Dr. King. I'll be discussing findings from a secondary analysis of data focused on bullying victimization, weapon carrying, and firearm carrying. Next slide, please. So this analysis was part of a broader aim to apply general strain theory to adolescent weapon carrying. So the main hypothesis of the theory is that experiencing strain increases the likelihood of engaging in crime or delinquency. So here strain was represented as several different forms of bullying victimization. So I had 2 firearm-related goals. First, to examine differences between the associations of bullying victimization and 2 types of weapon carrying, so firearm and non-firearm. And second, to investigate whether there are characteristics that differentiate students who recently carried firearms from those who recently carried other weapons. So the sample includes 7th through 10th grade students who participated in the 2009 and 2010 Health Behavior in School-Age Children survey. Next slide, please. About 2.5% reported carrying a firearm in the past 30 days and 12% reported carrying another type of weapon. Compared to respondents who reported that they hadn't recently carried a weapon, firearm carriers were less likely Black, less likely Hispanic, and more likely male and of higher affluence. Having a friend group that consisted mostly or entirely of weapon carriers and having low social support were also both factors that increase the likelihood of firearm carrying. So turning to carrying frequency, one part of the multinomial model compared frequent or persistent firearm carriers to those who reported no weapon carrying of any kind. So compared to non-carriers, frequent firearm carriers were older, more likely male, affluent, and again had friend groups consisting of weapon carriers. Notably, frequent firearm carriers were less likely to attend urban school districts. Finally, among the subsample of respondents who reported recently carrying a weapon, male sex and having a weapon carrying friend group were differentiating characteristics that significantly increased the likelihood of firearm carrying. Next slide. So although certain forms of bullying victimization were positively associated with weapon carrying, there were no significant associations with firearm carrying. So this suggests that it may be important to continue distinguishing between the type of weapon carried, as the risk factors for weapon carrying can vary across weapon type. Second, having a weapon carrying friend group was a strong, consistent correlate of firearm carrying, so future efforts to study adolescent carrying would benefit from longitudinal data that explore the nature of peer associations and onset of carrying. And finally, given the dearth of research examining carrying among rural and suburban populations, as well as the finding here that frequent firearm carriers were less likely to attend schools in urban districts, future studies should broaden their analyses beyond populations in urban areas. Thank you.
Thanks, Stephen. And thank all of our presenters, and particularly for sharing such key information about your research and your ideas in these mini presentations. I appreciate that that's challenging, but also how rich the information has been that you've shared with us. So let's move on to some questions. And I'm going to start with some that I have here and try to pose at least one question for each of our speakers. So let's start with Hooman. I'm wondering what your thoughts are, Hooman, on legislation that has been or may be effective in pediatric firearm fatality prevention.
Yeah, I think that's a really important area, and I think that thinking about ways to reduce pediatric firearm fatality requires thinking about things at kind of every level of intervention. So things all the way from clinicians encouraging parents to keep their firearms stored in a safe way, up to legislation that encourages parents to keep firearms stored in a safe way. Thinking about some of the forms of legislation that I think there's been some work on. We think about firearm laws such as safe storage laws, which have been looked at in various states, and we know that 25 states have some form of this law, and we know that a smaller number of those states have a strong form of that law. And in those states with stronger forms of those laws, we do see reduced rates of pediatric firearm fatalities in these children. So I think that it's all associations and it's all correlations, but I do think that there's kind of a wealth of evidence that kind of shows that these associations hold true for various types of laws, and I think that's an important thing to think about.
Thank you. Melissa, I wondered if you could say something about the representativeness of the states that were involved in your analysis, and also, if you happen to have it, what proportion of firearms were owned by a parent or other household member?
With regard to the representativeness of the states, there were 16 states represented in 2007. My study covered 2007 to 2017. So there were 16 states in 2007 and 37 in 2017. Now NVDRS covers all 50 states. So moving forward, we'll have more data, which is great. With regard to the owners of the firearms, unfortunately, there's a lot of missing data in that regard in NVDRS. There was a study published recently looking at firearm suicides among youth less than 21 years of age, and they found that the data was missing for 2/3 of those cases. But in the cases that they had data on the firearm ownership, 2/3 of the firearm owners were parents or other family members. So it's something that we would want to collect more data on for sure.
Okay, thank you. And Rebeccah, I'm wondering if you might say something about what you see as some next steps after publishing the review.
Yeah, so I think next steps in this field of work is to really hopefully identify some practices and some potential avenues for training for mental health providers in firearms means restriction. That's, I think, the next step of this. We identified some practices that have been implemented in the field, but overwhelmingly, especially students in schools of social work across the nation are not consistently getting training in firearms means restriction and suicide prevention and suicide assessment. So I think that would be, the goal is potentially creating a course that could be implemented in BSW and MSW programs to inform firearm means restriction.
Okay, thank you. And as I continue, I also invite our audience to post questions in the Q&A. Suzanne, would you say a bit more about the difference between effect, modification, and interaction, really digging in here with the details, and what that may mean in terms of suicide prevention?
Sure, I'm glad you asked. Effect modification is simply, do you have an effect that is modified by something else? Interaction is, if you have two separate things existing, do those two things have a additive or a multiplicative effect on the outcome variable? Multiplicative, there's interaction. You could have one, you could have another, or you could have both. So what does that mean for prevention practices? It's all about trying to tailor prevention efforts as finely as possible where they're needed. And then when you're talking about firearm-specific suicide prevention practices, tailoring those things as finely as you can throughout the state so that you can focus your energies on storage, et cetera, appropriately. Did that answer your question?
Thank you. And I'm also thinking you're maybe in the Windy City. Is that true?
Yes, I'm sorry. I live in a small urban condo, and this is the only place I can escape my family. Sorry.
No, we need some variation here. Okay, it makes it feel more like it's real life when we don't all have exactly the same background. Okay, let's go to Corinne. Corinne, how do trends in suicide with firearms differ by rurality?
So suicide is up, increasing 2 to 4%, for the last decade for almost every socio-demographic group. The one exception might be middle-aged men who it's relatively stable or less increasing, but certainly they're not seeing a decrease. So we are seeing disproportionately high rates in rural areas, although the populations are less stable. So the standard deviation is just larger because one suicide makes a lot bigger difference. And we're also seeing the increases go up, but since we have that bigger standard deviation, it's not going up in a way that the standard error is surpassing there's overlap with the non-rural standard error confidence limits. But I think that I also do a lot of work globally, and one of the things that a lot of people globally are talking about is that suicide, especially youth suicide, is increasing globally. So there's something intercultural, cross-cultural that's going on. So it just means there's so many things we can look at to think about for prevention.
Yeah, okay, thank you. And Karissa, how are you thinking you might expand on the research you've shared with us as you go forward in your career?
Hi, thank you for the question. In terms of going forward in my career, I actually intend to look at the same or similar questions, but with a comparison breakdown of, instead of just children and teens, doing those who are not school age, elementary school age, middle school, and then high school and beyond. I also intend to compare them to adults as well to see if there are any significant differences there. because if we are tailoring our intervention and prevention strategies to children and teens, we should also take a look at what's going on with the adults and seeing how they differ, and if prevention and intervention strategies can overlap.
Okay, thank you. It's, there's a lot
Thank you.
ahead of you. And Stephen, how was low social support defined or operationalized in your study?
Yeah, it was a combination of 4 items, measuring parental or guardian support. And it was previously operationalized this way in one other study that used the health behavior in school-age children survey. So it used these 4 items, and it was achieved relatively high internal consistency. It asked about the extent to which the parent or guardian is loving, helps them as much as they need, understands their problems or worries. And I think the 4th one had to do with helping them feel better when they're upset, which would kind of tap into the idea of having a coping mechanism where you wouldn't be engaging in delinquency if you had this sort of conventional outlet.
Yeah, there's, thank you for sharing that. There's such a growing interest in social support and connectedness, trying to understand it, especially in the suicide prevention field, and a priority of the CDC. And I think measurement has been quite challenging. So it's helpful to hear how people are operationally defining that. Just one other, perhaps a small question for you. How did you handle surveys with missing responses?
Yeah, so missing data was relatively limited, but as with any large survey like this, it was present. So I think the variables had less than 5% missing responses, but I used multiple imputation by chained equations to impute the missing data.
Okay. Let's see, do we have any other questions coming in? Let me pose, I'm going to pose another one for a couple of speakers, and then we're going to, I think for one speaker, and then we're going to wrap up. Corinne, what's your thought on why the type of weapon that's used in a suicide matters?
Well, I think the growing evidence base shows that lethal means restriction can be really effective, that no matter what the suicidality profile, the decision at that time is a very acute decision. So raising the rail on a bridge, or making sure there's nothing lethal drug overdose wise or hanging wise or firearm wise can be very, very effective. And I do think it's going to take a little bit different messaging depending on why that firearm, why the person who might be making that decision at the moment has access to that firearm and how they have access. So I think it matters because people have different weapons available to them for different reasons through different avenues, and that we can have a lot of opportunity to message based on that knowledge. And without the NVDRS, which to me is just like a gold mine, you know, we wouldn't know the type or who owns it or where it's stored. So it's really magical in how impactful this data can be for our prevention decisions. And I'm so happy to see so many people on the panel using this and other data to help make those avenues move forward.
So, wow, what a positive and hopeful and forward-looking thought to end on. Thank you, Corinne. And I want to thank all of our speakers for a really informative panel and for responding to all of these questions.